She is on half a pill of blood pressure medicine, and she has not felt as good as she feels in 7 years. Sometimes I think the word functional medicine is a trigger word for other conventional medicine doctors. And so I'm here today to dispel some myths about functional medicine, at least what it means to me. So if we haven't met, I am Dr. Odoy. I'm a board certified internal medicine physician. I'm also trained in functional medicine as well as longevity medicine and just integrative medicine. So part of, at least to me, functional medicine is looking at the whole person and also going to the root cause of their disease rather than just treating their symptoms. And if I could think back in medical school, we were taught this biopsychosocial model of medicine, which means that we look at the biological aspect of the person. We also consider their social, the way they live, and also their mental, their psychological, prospects. And we treat them within that framework. And so medicine, as long as I have understood it, we really started from a place of individualized care. We started from a place of looking at multiple factors that affect people's health before we prescribed. But over the years, it's shifted into a place of population health where we look at what has helped a majority of people, and we are expected to prescribe in that path. And some of it is important because you need to have guidelines. You need to have some, guardrails so that people don't get bad medicine or they don't get treated poorly by physicians. However, in my functional medicine practice, being able to apply this biopsychosocial model of medicine, I have been able to get very good results. A lot of my patients see me and also go to their primary care, and they get messages about how functional medicine is snake oil medicine. And some of them are actually discouraged from seeing functional medicine physicians. However, my patients have had really good results. And so I don't have to explain to them because I sit with them and I spend a lot of time just talking to them, understanding where they are coming from. What are some of the factors in their past that has contributed to their current situation, and how do we go back to fix it? So I'll give you just 2 examples. I had one patient who came in and had struggled with trying to lower her A1C for many years. And after 3 months of working together, we were able to lower her A1C by 2 points without using medications, without putting her on a ton of supplements. We just tweaked a couple of things in her lifestyle. That's one case. And then the other case, I had a patient who was on 3 different medications, saw multiple cardiologists, had elevated blood pressure, which remained uncontrolled. When I saw her, her blood pressure was in the 220s. Now, and I'll post her email to me up here. She is on half a pill of blood pressure medicine, and she has not felt as good as she feels in 7 years. For 7 years, she has not felt that good. So there are practitioners of functional medicine out there who may or may not be following certain guidelines, but we are all not the same. We all don't practice within the same guidelines. We practice with the basic biopsychosocial model in medicine that we were all trained during medical school. So please put in the comments below what are some of the myths or some of the things you've heard about functional medicine. And let's keep this conversation going, because I really think that people need to know what is at the root of their disease And so that when you create a treatment plan, it makes sense to them. They can, connect the dots and see where this could be coming from. And so it's easy for them to adhere. It's easy for it to become a partnership between a physician and his or her patient, rather than a paternalistic approach where these are the list of things I want you to do. And if you don't do them, I'm going to label you as a non-compliant patient or a non-adherent patient. And I'm just going to be upset with you. I think there is room, for all of us to meet the care needs of our patients.